Hi, this is Carol. I'm a practicing occupational therapist and a mom of a 2-year-old boy. Today I want to talk to parents, guardians, or anybody with a 2 to 3 or more year old child who is struggling with speech or who has speech delay. First of all, what is speech delay? Speech delay can be identified in a child who is 2 to 3 or more years and is not able to understand or use words, phrases, or actions to communicate his needs or to communicate to others. How can you identify a child who has speech delay? There are simple basic signs that you can use to tell that this child now has speech delay. First of all, when a child is not able to immediately produce relevant words or phrases, that definitely is one of the signs. A 24 months old or more should be able to articulate words into sentences or use 2 or more words to communicate his needs. Number 2, when a child finds it difficult to follow simple instructions like come, go, bring something, that is also a sign that this child may be having speech delay. Number 3, when the child uses abnormal tone of voice whenever he wants to communicate his need or whenever he wants to communicate something, that means the child may be struggling and is a sign of speech delay. And another one is when the child has not yet started talking at the age of 24 months and above. Another one is when the child does not try to communicate, even using actions. Usually in a normal child where she or he has difficulty with speech or hearing loss, they will try communicating using gestures or signs. But here is when the child does not try to communicate even using signs or using primitive gestures. That is a sign of speech delay. And what causes speech delay? One most important thing that most parents of nowadays do is to make the child watch more TV than play. That is one major cause of speech delay. When the child spends more time watching TV or using phone, that could be a problem when it now comes for the child to learn to develop speech. It can cause speech delay. Some children have tongue tie, which could also be a reason where the child is not able to speak properly, because when the tongue is tied, they cannot articulate words and form sentences. They may have difficulty with pronunciations of vowels or letters. Another one is when more than 2 languages is being spoken at home. Do not confuse the baby. Speak one language that the child may be able to learn with ease and follow promptly as he learns. His speech development is ongoing. Another one is when the child has overall delay in growth and development. There are certain children that have general delay, so such children can be given some time, but when it surpasses 3 to 4 years, now it should be a concern. And then when the child may be having an oral motor disorder where the brain is unable to control the speech control muscles, like in the case of cerebral palsy. That could also be a cause of speech delay. And then there is another one when the child has hearing problem. Hearing is prerequisite for speech development in a child. So when the child is not able to hear, that could also cause his delay in speech development. Because hearing is one of the modes we use for learning. You cannot learn speech by not hearing what is being communicated or sounds. And then maybe the child may be suffering from an hearing infection too. That will also cause speech delay because the child is not able to hear properly during the infection. What should you do as a parent in case you have such a child? In case of hearing infection, it is advisable to seek for treatment early enough so that it does not affect the child's speech development. And in case of hearing loss, it is advisable also to seek intervention from an audiologist to carry out tests so that if possible, if the hearing loss can be contained, or the child can be provided with an adaptive aid to help him in hearing so that it can aid him in the process of speech development. And then, as a parent, you have to accept the situation that now my child has speech delay.